Anatomy, respiratory system. This is a general description of the internal cavity of the larynx. As we can observe, the root of the tongue is at the top, followed by the hyoid bone, the thyroid cartilage, and the cricoid cartilage. This helps us understand the structural organization of the laryngeal cavity. As we can see, the larynx appears larger than its internal cavity, primarily because of the arch formed by the thyroid cartilage. The laryngeal cavity is relatively small and narrows significantly, especially in its middle portion. The laryngeal inlet may seem like a simple structure when considering its cartilaginous and ligamentous components. At the top, we find the epiglottis and its tubercle. Laterally, the aryepiglottic folds contain the cuneiform cartilages and extend down to the arytenoids. Finally, we find the coniculate cartilages, which are positioned on top of the arytenoids, along with structures connecting the arytenoids, such as the transverse interarytenoid muscle. The laryngeal cavity contains two horizontal folds located one above the other. The superior vestibular folds false vocal cords, which arise from the quadrangular membranes. The true inferior vocal cords, which derive from the upper thickening of the conus elasticus of the larynx. Of course, the true vocal cords will move, while the false vocal cords remain as simple folds. When discussing the laryngeal cavity, it is important to mention its different portions. If we observe a coronal section, we can see that the larynx is anatomically divided into three main regions. The upper part is called the vestibule, which ends at the level of the ventricular ligament, the lower thickening of the quadrangular membrane. In this area, we find the walls formed by the quadrangular membrane, shown on the left in dark green. At the top, we have the aryepiglottic folds, which represent the upper thickening of the quadrangular membrane and also form a significant part of the laryngeal inlet. Then we have the epiglottic cartilage, which anteriorly delimits the laryngeal inlet. Finally, we can observe the laryngeal saccule, an upward protrusion of the laryngeal ventricle located in the middle part. The last structure to observe is the interarytenoid fold, which closes the laryngeal vestibule at the back. Although it is not shown here, it is clearly visible in the image on the left between the two arytenoid cartilages. Next, we have the middle segment, located between the ventricular and the vocal ligaments. Essentially, this is the region between the true and false vocal folds, making it an extremely narrow portion. This very narrow segment is the tightest part of the entire larynx. Here we find the rima glottidis, which is the space between the two vocal folds. However, this portion extends laterally to form the laryngeal ventricle, or Morgagni's ventricle, which is bounded by the elastic membrane and in the middle portion. As you can see, it forms a slender sac around a very narrow opening, representing the space between the ventricular and the vocal ligaments. The laryngeal ventricle plays an important role in improving the ability of the larynx to produce sound, essentially acting as a resonating chamber. Lastly, we have the inferior segment, located below the vocal folds. In this area, we find the cricoid cartilage, whose lower border also marks the passage into the trachea, and the conus elasticus, which represents the collection of elastic membranes in the lower part of the larynx, as we saw earlier. Thus, the larynx has two main functions. The first is phonation, which is the ability to produce sound. This ability is often underestimated, but it is fundamental to language development according to some theories. Phonation is extremely important, and it is carried out by the larynx through its ability to modulate the extent of the rima glottidis. as we observed in the previous lesson. This is achieved by moving the arytenoid cartilages through a variety of muscles. The second function, often overlooked, is known as abdominal fixation, which is essentially the Valsalva maneuver, an expiratory effort with glottis closed. The larynx can indeed close during an inspiratory effort to increase pressure within the chest. The Valsalva maneuver is extremely useful in medicine and physiology. For example, coughing is essentially a Valsalva maneuver. In the first phase, the larynx is closed and the chest pressure increases. Then the glottis suddenly opens and the cough is emitted, namely an exhalation at high pressure, which is only possible because the glottis is initially closed. The Valsalva maneuver is also used in diagnostics to increase abdominal pressure. Many diagnostics maneuvers rely on this principle. Finally, let's conclude with the microscopic structure of the larynx. It is made up of a mucosa with the lining epithelium varying from conified stratified squamous epithelium in some areas to non-conified stratified squamous epithelium, the most common type, to respiratory epithelium. Then we have a complex lamina propria composed of dense connective tissue, which in the lower part forms a true elastic membrane containing a large number of elastic fibers. In the dense connective tissue, there are acinar tubular glands with mixed secretion, along with vessels and nerves. Furthermore, there is a rich physiological inflammatory infiltrate which forms lymph nodes in some areas, especially in the epiglottis. In some regions, the connective tissue appears looser and more edematous, particularly in the area of Morgagni's ventricle. Lastly, we obviously find cartilage, which can be fibrous or elastic in some cases and completely hyaline in others. We have already described the differences between hyaline, fibrous and elastic cartilage.
This video was created thanks to Anatomy Learning, an interesting free web app. The hyperlink can be found in the description. Instead, the text used for the concepts is Human Anatomy of Eddie Hermes. Thanks for watching.